Hello, this is Dr. Aarti Kandolkar. I'm a consultant psychologist and a counselor. Today we are here to discuss on a very important topic of schizophrenia spectrum and other psychotic disorder. We were discussing about the types of schizophrenia spectrum and other psychotic disorder. We have already discussed the two, that is delusional disorder and schizotypal personality disorder. Okay, the third one is brief psychotic disorder. Let's understand what are the key features of this disorder. Brief psychotic disorder is a disorder that lasts more than 1 day and remits by 1 month. So this is like the duration of this is minimum of that of 1 day and ends by 1 month. So as the term goes, it's a brief. Okay, it's not like typical classical schizophrenia which has to last for a year, 6 months. Okay, the 1 day to maximum 1 month, it should end by that. Okay, remits means to become less severe for a time without absolutely ceasing. So it becomes, remittance is there, so it becomes less, okay, without absolutely totally going. So what are the brief symptoms of this, or you can say key symptoms of this is presence of one or more of the following symptoms. At least one must be from 1, 2 and 3. Just like to diagnose schizophrenia, it's like the symptom of delusions, hallucinations and disorganized speech. Okay, at least one of them should be there. Okay, so there should be at least one from 1, 2 and 3. Okay, and grossly disorganized or catatonic behavior can be there. Okay, it's like behavior is either rigid or flexible, or very too much flexible, and grossly disorganized behavior. Okay, it's not so organized, or you are not doing things very systematically. Okay, sometime in particular cultures, okay, there are certain behavior that seems to be normal, but other culture it not be. So you have to pay attention whether even this grossly disorganized catatonic behavior, hallucination, delusions and things are very normal to in a particular culture or not. Okay, maybe that thought process is very much common in one culture and may not be others. So you have to pay attention to that. The next is duration. Okay, the B criteria, the duration of the episode of the disturbance is at least 1 day but less than 1 month, that we have seen, with eventual full return to pre-morbid layer of functioning. Okay, so it is like the person can come to a normal functioning within 1 month. Okay, he has suffered psychotic symptoms like hallucination, delusions, disorganized speech and all. Okay, so if it is a big psychotic disorder, a person will return back to his normal functioning within a month. Okay, the disturbance is not better explained by major depressive or bipolar disorder with psychotic features or any other psychotic disorders such as schizophrenia. Okay, so it should not be. Okay, you have to be very careful while diagnosing. It should not be the symptoms are or psychotic symptoms are due to major depression. Okay, it should be because of major depression, or it not be because of bipolar, or it should not be because of any other psychotic disorder like mood disorder. Okay, so you have to pay attention to that. Okay, even catatonia, and not attributable to the physiological effect of substance. Like it should not be again you are getting this symptom, okay, of psychotic is because of your drug abuse, medicines, okay, or any other medical condition which can produce psychotic symptoms. Okay, so you have to pay attention to the C factor of that and specify if marked with stressors like with and postpartum onset. Again, the postpartum, due to postpartum, a lady can experience brief psychotic symptoms. So you have to see whether she is suffering from postpartum depression or it is purely a brief psychotic episode. If you treat this brief psychotic episode in time, a person can be saved as well, but it is very tough to identify in the initial stages. And if it is remain untreated or if it is repeated, it can become a residual schizophrenia also, which is not there in DSM-5 now. It's like the residues remain in a person, and the person can suffer psychotic symptoms in any other what you can say lifetime, anywhere. Okay, so if you get any of these symptoms in any person, even for a few days, try to go to a doctor rather than just trying any other measure, locally measures. Okay, the next is treatment method for this. First treatment method will be medicines, okay, antipsychotic, because these are psychotic symptoms are there. Therapies like CBT, REBT, anything that works with the person. Even behavioral therapy can be tried. The third one is psychoeducation. This is like making people aware about the symptoms of brief psychotic, like they are suffering and it is temporary. Okay, this can be done through a therapist. The fourth is hospitalization may be necessary, okay, until positive symptoms are under control. What are positive symptoms? Hallucinations and delusions, okay. The next is schizophreniform disorder. This is the fourth one after brief psychotic. So let's understand what is the difference between brief psychotic and schizophreniform, okay. Schizophreniform disorder, as the term, if you want to understand, just look at this schizophreniform. So it is like form of a schizophrenia, or which symptoms that schizophrenia has may contain in this disorder. Okay, so let's understand the diagnostic criteria quickly. So 2 or more of the following for during 1 month period. So again, this is for a 1 month period, and see exactly what is the duration of this. Okay, again 2 or more. So one has to be maybe from this 3. Generally, it has to be from 1, 2 and 3. And the second symptom can be from 4 and 5. You cannot have only 4 and 5 as the 2 symptoms of schizophreniform disorder. It has to be 1 from this and 1 from this, or you can have more than 1 or more than 2, sorry. Symptoms similar to schizophrenia, but duration is less. Now, what is the duration? This could be anywhere from day 1 to 6 months, but less than 6 months. So it is like 1 day to less than 6 months. So you can say 5 months and 29 days or 30 days if it is 31 days. Okay. And if it is complete 6 months, then it will go into classical schizophrenia or classic schizophrenia type. Okay. Let's understand how it is different from schizophrenia also. Schizophreniform disorder is a type of psychotic illness with symptoms similar to schizophrenia. So there is no much difference with schizophrenia in this, okay, but lasting less than 6 months. This lasts less than 6 months, while schizophrenia lasts 6 months or more. Okay, that is the first difference. Like schizophrenia, schizophreniform disorder is a type of psychosis. Again, one similarity is it's a psychosis type in which a person cannot tell what is real from what is imagined. So there is a breach into the reality. They are not aware. While impairment in social, okay, their interaction with the society, occupation, academic functioning is required for diagnosis of schizophrenia. Now, let's understand this point. In schizophrenia, this functioning level of the person, okay, in academic, occupational, social is largely impaired. While in schizophreniform, just like delusional disorder, they are more functioning. They can do their routine things quite well. And that is why it is very difficult to identify even schizophreniform and delusional disorder. Okay. So this is like in schizophreniform disorder, an individual's level of functioning may or may not be affected. You have to mark this. Okay. So the functioning level, what to do in daily things, okay, grooming and doing your job, chores, responsibilities and all, person with schizophreniform may not be that affected and he'll be more functioning than person with schizophrenia. Okay, so this treatment of this disorder is medicines, antipsychotic majorly, mood stabilizers can also be used. Okay, then even anti-anxiety and antidepressants can be used if it is comorbid. Then therapy could be psychoeducation if they do not come for REBT or CBT. Behavioral therapy can be applied, giving some techniques to modify the behavior. Social skill training can be given. They can be sent to daycare centers for enhancing their social skill and their functionality. And hospitalization until positive symptoms are under control. Sometime when it is not getting under control, it is severe, you may have to put the person in an hospital for a few days or maybe some weeks. So now let's see the difference between schizophreniform, brief psychotic disorder and the schizophrenia, this three. Okay. So the first we'll see about the schizophreniform disorder. This is like 1 month to, you can say, less than 6 months. Okay. It can last somewhere around 1 month to less than 6 months. Okay, it should not cross 6 months. Okay, so this one, the schizophrenia, on a contrary, it should be more than 6 months. And brief psychotic disorder, it should not be more than, it should be less than 1 month. Okay, so this is how. What is the difference? The symptoms may remain the same. Okay, except delusional disorder, like are a different disorder, that is doesn't have psychotic symptom, but rest all these three, schizophreniform, brief psychotic and schizophrenia, symptom may remain the same. Okay, only the difference is the duration. Okay, so brief psychotic less than 1 month, schizophrenia less than schizophreniform less than 6 months, and schizophrenia or classic schizophrenia is more than 6 months. Although active phase of schizophrenia can be identified within 1 month, but officially you cannot consider somebody to be suffering from schizophrenia who is less than 6 months. Okay. The next is our classic schizophrenia. Okay, let's understand this disorder. Schizophrenia, very classic. And we know the typical symptom of schizophrenia are, it requires two or more of the following for a significant time during 1 month active phase symptom. So as I said, there could be 1 month active phase symptom, okay, wherein it is, can say, temporary, you can identify it as a schizophrenia, okay, but to like what you can officially say it, it has to cover 6 months. The symptom should be, for out of this 3, at least 1 should be there, and from this 2, at least 1 should be there. So minimum 2 symptoms. Maximum can be all 5 also. Okay, but it has to follow this. Out of this 3, 1, and from this 1 minimum. So this is a classic identification of schizophrenia according to the DSM-5. Okay. Since onset of disturbance, level of functioning in work, social relationship or self-care is below what it was prior or what it was prior, or failure to achieve expected level of onset, okay, in a childhood or adolescent. हा मला वाटतं पुन्हा करायला पाहिजे. Schizophrenia slide. Okay. Now schizophrenia, let's go ahead. The second point is in onset of disturbance, level of functioning at work, okay, social relations or self-care is below what it was prior. Okay, so in schizophrenia, since the onset start, your level of functioning is definitely going to deteriorate, okay, gradually. Or failure to achieve expected level of if onset in childhood or adolescent. So onset can be childhood schizophrenia or in the adulthood, okay, or late teens, anywhere it can occur. Symptoms persist for at least 6 months. Officially, 6 months, this symptoms should be lasting. Are major symptoms according to DSM-5, with psychotic symptoms typically emerge between the late teens in males in early 20s. Okay, so generally there is a slight different criteria, or you can say which is identified by research. Schizophrenia occurs in male in late teens or before, in around 20s, early 20s. For women, it is slightly later. It's like 25 and above, or late 30s. It can happen in a woman. And also while diagnosing, as we know, you have to rule out substance abuse or any other mental disorder or physical disorder that you may be suffering and taking medicines for, which may itself produce some symptom of psychosis. Okay. Also, you can look for prodromal phase in women that occurs late. Now, what do you mean by this prodromal phase? Now, as a term, there is a meaning for this, but actually to identify prodromal phase is quite difficult. Prodromal phase is the beginning of symptoms that person may develop schizophrenia. Okay. Now, they are mostly like negative symptoms. Okay. Negative symptoms. Now, what is negative symptoms sort of? It's like withdrawal from the society, not interested in what things were interesting to you in the past, okay? Or you may have some grandiose kind of a delusions, or you may self-talk, okay, self-mutter, okay? So many things can happen, and you seems like it is a slight of a depression or sadness entering into the person. So it is better said than done. It is like, it's easy to say this is prodromal phase, but identifying to a parent or even the professional is quite difficult. You cannot go back and retrospect it was a prodromal phase or it is going on predromal phase. It's very difficult, okay? But person can be definitely aware of what is prodromal phase and try to show to the doctor if they are keen in keeping their family members well, okay? It can happen to anyone. Prodromal, let's understand in more detail what is prodromal. There could be negative symptoms, okay? That is deficit in behavior. They are reduced functioning. They may not take care of their self, grooming, okay? Or even eating, sleeping habits may be disturbed. Reduce emotional expression. You can see they are less emotional, or you can say less expressive. They like keep to themselves, don't like to mingle, go out, having social anxieties, lack of motivation and energy in doing things that earlier was not so problematic, okay? Loss of enjoyment in activities, social interaction. They may not like meeting people. Negative symptoms tend to be more persistent. This withdrawal from the house or people interaction is most persistent. It continue to stay. Disorganized speech, talking haphazard, illogical, okay, using few words to convey your meaning or anything, or talking to yourself, muttering, everything can happen in disorganized speech, okay? This could be one of the symptoms. Inability to maintain yourself, disorganized and catatonic behavior, okay? Your behavior can be disorganized, not wearing proper clothes or behaving, having etiquette, maybe not so well maintained, basically. You can be also catatonic, means you can be having flexibility or rigidity in your behavior or talking and your general behavior, okay? And bizarre conversation. You can talk, maybe use some words, or the language that you use may be so magical, or it can be so rhyming. Okay, it can change entire your speech, your thoughts, your emotions, your behavior. Okay, so in prodromal phase, although it is not clear cut that person is developing schizophrenia, but you can be just be try to aware. Okay. Treatment for schizophrenia is first degree is antipsychotic. Okay, medicines are very, very important once you identify. Second is psychoeducation, making people aware about the symptoms and how they can be taken care of. Social skill training, if they have lost some functioning, you can make them like try to educate them, try to make them learn. Hospitalization until positive symptoms are under control. Since there are hallucination and delusions, you can for temporary you can put the person into an hospital or daycare wherever possible, and manage their stressors. Okay, the ongoing temporary stressors can be managed. You can listen to them, okay, rather than criticizing them or saying you're not doing this good, this is not appropriate. Try to listen whatever they are saying, try to be supportive. Okay. So difference between the three disorders, we already seen the brief psychotic, schizophrenia, and the schizophreniform disorder. Okay, we are not discussing this again, but the slide is there. The next is duration. What is the exact duration in a short? Brief psychotic is less than 1 month, schizophreniform 1 to 6 months, and schizophrenia is more than 6 months. Okay. So the major diagnostic criteria, if you miss somewhere, okay, how to identify? So this is like 2 or more symptoms should be there, okay, for significant portion of time during 1 month period. Minimum is 1 month for schizophrenia, and if successfully treated, then it is not counted. At least one must be present. So out of these 3, okay, there should be at least 1, okay. There should, out of this 3, 1 should be there, and from this 2 should be 1, 2. It can be more than this, and duration should be more than 6 months to identify schizophrenia. So we have covered so far 5 different schizophrenia spectrum and other psychotic disorders. We'll be moving on to schizoaffective disorder. So we have already discussed the 5 subtypes under schizophrenia spectrum and other psychotic disorders. So this is the 6th one, schizoaffective disorder. So let's understand this, starting with an introduction. So let's see what are its points, key points. The schizoaffective disorder describes a condition that includes aspect of both of what? Schizophrenia and mood disorder. So this is a combination. If suppose schizophrenia and mood disorder, you take it as a parent, so this is like the child, okay, the child of schizophrenia and mood disorder. So it will have psychotic, maybe major depressive disorder or bipolar disorder. So it can come in this combination. Now let's understand this. Schizo means schizophrenia symptoms are there. Affective means emotions are affected, means this is moods. Okay, so schizophrenia means psychotic symptoms and affective means mood. So it is like, as I said, it contains the schizophrenia symptoms and mood disorder. This disorder which lies on the borderline between schizophrenia and mood disorder. So this is like all the symptoms, like as we already know, schizophrenia and mood disorder are major psychotic disorder. Okay, this is like the child. So this is like it will have all the major symptoms. Okay, these symptoms of schizophrenia and mood disorder can be in the same episode, although there may be some gap of 1 or 2 weeks between like one episode of mood disorder, then schizophrenia, or maybe schizophrenia first and mood disorder. So it can occur one after the other. Okay, so let's move on to the more information. The course is usually episodic. Episodic means may last for some time, okay, particularly in manic subtypes. So manic subtypes is just a manic episode wherein you are like heightened stage, or you can say in a euphoric mode, okay, although a chronic course in some patient has been described, particularly in the depressed type. So this is a short-lived, okay, usually, and manic episode, as we know, it's not a long term. Manic episode may be around 4 days or maximum around a week, okay, but the depression type may be longer in duration. That is why it is called chronic, okay. So this may go in a chronic course with depression. The symptoms of both disorders may be present simultaneously or may follow within few days of each other. So it may be simultaneously or maybe works after few days, few weeks. Okay. So this is more or less some information about the schizoaffective disorder. Some specifiers, means you need to pay attention if you are diagnosing somebody with schizoaffective disorder. First, schizoaffective disorder bipolar type, means when both the modes of mania and depression are there. Okay, bipolar disorder with its extreme mood swing from depression to mania type. Okay, so it is like when there is a bipolar, you have to see for its mood swings. Okay, so there will be mood swings, that is from depression to mania type. Then second, schizoaffective disorder depressive type. So these are various specifiers you can identify with schizoaffective disorder with bipolar type or schizoaffective disorder with depressive type. And the third type that you can diagnose is with catatonia. Okay, catatonia we'll be discussing in the 7th place. So we'll also see that. Treatment of schizoaffective disorder, means possible treatment. This may not be the 100% the best treatment for everyone. So first one is mood stabilizers for bipolar type. Okay. Then antidepressant for the depression. Antipsychotic will be used when there is a psychotic symptoms, because it is like mania. Sorry, it can be mania, it can be severe depression, it can be both. Okay, bipolar type. So antipsychotics are necessary. Then therapies can include CBT, behavioral therapy. Okay, and psychoeducation is like making parents or family member or wherever the client is staying, they should be aware what is this disorder, what can happen in this disorder. Difference between schizophrenia and schizoaffective. Let's understand the difference between the two. In schizophrenia, mood symptoms are not expected to occur without psychotic symptoms. Means, without psychotic symptoms, okay, like hallucination and delusion, schizophrenia is not there. Okay, it has to be psychotic symptoms. The psychotic symptoms are almost always present in schizophrenia, but mood symptoms come and go. While in schizoaffective disorder, the psychotic symptom may or may not be present. Okay, but during the times when the person is experiencing depression or mania. So in schizoaffective, the difference is that schizophrenia, okay, is always with the psychotic symptoms, but in schizoaffective disorder, psychotic symptom may or may not be present. Okay, this you have to remember during the time person is experiencing either depression or mania. So this point, this is a basic understanding of all the 4 disorder that we just discussed. Okay, so this is like schizophrenia is a significant feature of most of the time into 1 month. That is 1 month is the active phase and more than 6 months is a clinical diagnosis, official diagnosis of schizophrenia. Okay, minimum 6 months is definitely needed for diagnosis. Okay, schizophreniform, similar symptoms like schizophrenia, but less than 6 months. So it should not cross 6 months in schizophreniform. Schizoaffective, as we just discussed, okay, is a major mood disorder occurring with psychotic symptoms and delusions. Psychotic symptoms means delusion and hallucination for 2 or more weeks. So see here the time limit. And brief psychotic disorder, okay, is a psychotic symptom. It's more than 1 day and less than 1 month. Okay, so it should not cross more than 1 month. With return to pre-morbid condition, previous condition in which the client was. Okay, so far this is clear. Catatonia. Okay. So let's understand what is catatonia. According to DSM-5, at least 3 of the symptoms from this is according to DSM, okay, 12 symptoms must be present during a diagnosis of catatonia. It's a very rare disorder, okay, rarely occurring. The first symptom, okay, minimum 3, at least 3 should be there. So first one is stupor, okay, obvious inability to move or respond to stimuli, means the person may not be responding to an environment, okay. Cataplexy, rigid body posture is possible. Second, mutism we know, lack of ability to talk, so it is little or no verbal communication. Waxy flexibility, okay, body remains in a stiff position, okay, whatever position it is placed by another. So somebody is placing a hand like this, it will remain for a long period in that position. Negativism, lack of verbal response, just like mutism. Posturing, okay, holding the posture or position that goes against the gravity. So they may stand upside down, okay, or put up like on their heads. So this is like posturing. Mannerism is extreme or odd movement and mannerism, which is very weird. Okay, stereotype, frequent repetitive movement for no reason. So it is like stereotyping. So it is like repetitive movements for no reasons. You are just repeating the movements without any purpose. Okay, agitation is for no reason, grimacing or distorted facial expression. The person may be doing something facial expression which is not normal, okay, and they may stay in that position for longer time as well. Echolalia, it is like repeating other person's work. Suppose if you say, how are you? The person may repeat the same thing, how are you? Rather than answering, I'm fine. Echopraxia, okay, it's like repeating other person's movements. Like whatever the other person is doing, the person will do the same thing. Okay. So basically in catatonia, person can stay in one position for days, even a week, okay, and even in a against the gravity position. And sometimes this is so severe, the person can die in this position because they are unable to drink and eat, okay, although it is a very rare situation to happen. So catatonia is associated with that. So this is like various criterias, okay. Catatonia associated with another mental disorder, so you can specify this. Specify. Okay. Catatonia disorder due to another medical condition. It could be because of other medical condition the person is already having. An unspecified catatonia and catatonia without any reason. Okay. Mostly negative symptoms seems seen, and it is likely that they are fantasizing, listening or seeing something. So why do the person stay in the same position, like in one position? So they may stay for hours, even days and weeks. So why would that do? So generally, according to the research, they say either the person is an imagination, okay, he's talking to something, to someone, or they are listening to some conversation, and then you see them like smiling or blushing or something, and there seems to be no obvious reason. There is no somebody outside. So basically they are internally imagining everything. So they are fantasizing, listening to something or seeing something. So they are visual hallucinations maybe. Okay. Treatment of catatonia. Medicines, antipsychotics are mostly used. Then therapy will include behavioral therapy, psychosocial therapies, cognitive behavioral therapy if it works. Okay, so it's all subjective. So we have seen the various treatment of catatonia. So what you have to do, like we have discussed so far all the subtypes of schizophrenia spectrum and other psychotic disorders.